Hello, my name is Sophia Oftar. I'm a student physical therapist assistant at Rhodes State College. Is it okay if I work with you today?
Yes.
Okay, a few questions for you before we start. Could you give me your full name and your date of birth?
Noah Oftar, 8/16/06.
Okay, so I see here that you have left iliotibial band syndrome and you've been experiencing pain for about the past 3 months. Does that sound correct?
Yes.
Have you had any new or changing symptoms lately?
Not really.
Okay, so what has this been keeping you from doing?
CrossFit and running.
So I see you've noted that you've been having tightness and pain. Has any of that increased lately?
No.
It's just hard to go running and do the
Yeah.
CrossFit training. Okay, so first what I'm going to do is I'm going to have you stand up and do some motions with me so I can see how you feel about that. Could you move your leg forward, back, out to the side, back, and then back. Okay, you can sit down now. How did that feel?
Not bad.
Was there any one motion that was worse than the other?
No.
Okay, so what the plan is for today is I'm going to be using a moist hot pack on your IT band to hopefully reduce the tightness and the pain and kind of get you closer to that goal of getting back to running and CrossFit. So does that sound good?
Yes.
Okay, so what I'm going to have you do is I'm going to have you lay down on that side with your left. And the first thing I'm going to do is palpate the area to feel for the tightness. How does that feel? Does that hurt when I do that? Okay, so I will be using a moist hot pack, and it would have the proper 6 layers on it, so you don't get burned, or it's the right amount so you can get heat, but it's not too hot or uncomfortable. So have you been using any topical treatments?
Yes, BioFreeze.
Okay, so in this case, I would wash off the area because you don't want to have BioFreeze on when you're using a cold pack or a hot pack, because BioFreeze desensitizes the skin and it can cause reactions when you have a hot pack or a cold pack on top of that by burning you or causing discomfort. So after I wash that off, I would set this on the IT band with the proper amount of layers and make sure it can stay there. I can put stuff around it to keep it in place. And in 5 minutes, I'm going to come check on you, check on how you're feeling, what the skin's looking like. Does that sound good?
Yes.
And if at any time it feels painful, just take it off. Or if you're uncomfortable or it hurts, just take it off and I'll come back and I'll adjust the layers of protective layering on it, and then we'll get back on with the treatment.
Yes.
Okay, so 5 minutes have passed. I check. The skin's a little red from the heat, but how are you feeling?
Good.
Okay, so we're going to finish off the 20-minute treatment. 20 minutes have passed. I'm going to take this off. I'm going to feel for the tightness, and okay, so it feels like it's a little less tight. Does it feel a little better?
Yeah.
Okay, I'm going to have you sit back up. How is your pain feeling from a scale of 1 to 10 now?
About a 3.
Okay, so it's the same as earlier, but it's
A little bit less.
okay. Yeah. So what I'm gonna have you do is an at-home exercise program to get you back, hopefully a little faster with your recovery. Does that sound okay with you?
Yep.
So do you have a hot pack or a heating pad at home?
Yes.
So what I would like you to do is for 10 minutes a day, lay down how you just were, and if you have the electric heating pad, is that what you have?
Yes.
I want you to put it on the lowest setting to prevent any discomfort or burning the skin, since it is electrical, and I want you to use it for about 10 minutes a day, and that should help you recover a little better, and so you don't have to come in here every time to get that treatment. Is that okay with you?
Yep.